engagement brought together officials from the Ministry of Health, development partners, civil society organizations, gender advocates, and the media to review a 5-year roadmap aimed at strengthening gender integration within immunization services from 2026 to 2030. The plan seeks to address gender-related barriers affecting vaccine uptake, especially among underserved communities and zero-dose children across the country. The Gender Technical Assistant, Ginger Sofreko Rudpunde, said the document provides clear strategies for integrating gender considerations into all levels of EPI operations, from policy development to service delivery. She explained that the plan focuses on key areas, including staff capacity building, gender-responsive budgeting, strengthening monitoring systems, community engagement, leadership, and policy implementation. She further noted that harmful misconceptions surrounding vaccines, including the HPV vaccine, continue to affect immunization uptake, particularly among women and children.
We recommended for integration of other departments and also involvement of all levels of staff, spanning from the PM right down to the cleaner. We want them to be involved in gender integration, and we also encourage them to be monitoring the gender-related activities and indicators to ensure that they are achieved.
The expanded program on immunization focal person, Sister Margaret Kangbai, described the initiative as timely, noting that findings from previous assessments revealed gender issues as one of the major barriers to immunization coverage in Sierra Leone. She emphasized that gender discussions should include both male and female, adding that greater male involvement in child health care and vaccination will help improve immunization coverage nationwide.
So there was a time that we had a consultancy for gender barriers, looking at gender barriers. So GPIGO did a study to identify some of the barriers limiting immunization services, because there are times we are struggling with our immunization, our coverages. So we had GPIGO had to do the survey, and gender issues came out strongly to be one of the leading barriers to our immunization services. So that's why Gavi had to consult a firm, which is the Ginger Sofreko, and they attached 2 technical assistants to support the expanded program on immunization, making sure that we address gender issues in immunization service delivery.
Programs Coordinator, Sierra Leone Social Marketing and Development Agency, Sako Diama, encouraged men to support women and children in accessing vaccination services, stressing that immunization is a shared responsibility.
When the child is born, and if the child does not get his or her complete vaccination, sometimes it leads to polio, it leads to other diseases. Sometimes even for the female, it leads to cervical cancer when you don't have your vaccination. There are other complications as well if you, as an individual, also get a vaccine. If you fail to get that vaccine, there are complications that you suffer. As an organization, we want to advise Sierra Leoneans that every Sierra Leonean should ensure that we come on board and ensure that immunization should not only be a female thing, but also men as well. I also say to my compatriot men out there that we should also involve in vaccination.
The engagement also highlighted recommendations for stronger collaboration among partners, including UNICEF, World Health Organization, and other stakeholders to ensure sustainable gender-responsive immunization programming in Sierra Leone. SLBC News in Freetown, Christiana Kamari reporting.